First, what is a veterinary prescription? It refers to a licensed veterinarian's written order and instructions to the pharmacist for the use of a veterinary medicine or product for a specific animal species. So here are the main elements of a veterinary prescription: name of the drug, dosage, route, frequency, date of initial dispensing and amount dispensed, number of refills, and the name of the prescribing veterinarian. The name of the drug refers to generic and brand names which must be distinct in order to avoid one medicine from being confused for another when pharmaceuticals are prescribed and prescriptions are dispensed. The dosage refers to the determination and regulation of doses because according to Paracelsus, every drug is a poison. The right dose differentiates a poison and a remedy. The route of administration is the way in which a drug enters the body system. Some examples of route of drug administration are oral, enteral, and intravenous. The frequency defines how often the drug is to be administered as events per unit of time. It can be once or twice or thrice a day or so. Date of initial dispensing and the amount dispensed. It guarantees that the proper medicine is supplied to the right patient in an effective form, in the correct dosage and quantity, with clear instructions and in a container that maintains the drug's potency. The number of refills. It refers to filling and selling a new dose or combination of doses of a drug that the patient's veterinarian has recommended. It allows you to see if the patient followed the specified drug regimen and if the vet made any medication modifications, allowing you to properly coordinate the chronic prescription refills. And of course, one of the most essential elements is the name of the prescribing veterinarian. Veterinary prescriptions also contain the pharmacy name, address and the phone number, the prescription number, the name and species of the animal patient, the directions for use, as it is important to follow and take the dose at the right time and also abide by any other instructions, name of the dispensing pharmacist, and the expiration of the prescription.
Your veterinarian has extensive education in animal medications and is best qualified to prescribe the correct medication for your pet in the right form and appropriate dosage. We all know that pharmacists are extensively educated in human medication, but most do not have specialized training in difference between human and animal pharmacology. There are important differences between pets and people in terms of dosage, potential adverse reactions, and reasons for use of the various medications. It is important that your veterinarian is involved in all decisions regarding to your pet's medication. So examples of important differences between veterinary and human use of medications. First is we have insulin. There are many formulations of insulin, but not all formulations can be used in veterinary medicine. Although an alternative form may be less expensive, substitution should not be made without consulting with your veterinarian, as the insulin might not be suitable for your pet. Next is we have flea and tick medications. Veterinary products that have been developed for treating fleas and ticks should only be used on the indicated species. Some flea and tick medications for dogs can be extremely toxic to cats, and one common complication is seizures. One flea medication commonly used for dogs and cats can be fatal if given to rabbits. And lastly, we have the xylitol. The natural sugar-free sweetener is toxic to dogs, and when ingested in small amounts, it can cause life-threatening low blood sugar within 10 to 15 minutes, and larger ingestions can result in liver failure.
Prescription valid refers to the time in which the medicine must be dispensed, otherwise the prescription will be no longer valid. A standard veterinary prescription is valid up to 6 months from the date signed on the prescription. A vet may specify shorter expiry date, however this should be for clinical reason only. The only exception for controlled drugs, in these cases, a veterinary prescription is typically valid for 28 days from the date signed on the prescription. If your vet has not included repeats or has specified no repeats, then the prescription is valid for one supply only, and we will need a new prescription for your next order. The date on the prescription can be the date it was signed by the health professional who issued it, or a date of the health professional has indicated the prescription should not be dispensed before. If the prescription should both of these dates, the 6 months start from the later date. This applied to medicine prescribed both on the National Health Service and privately. Always follow the instruction of the general practitioner or the person who issued the prescription about when to take the medicine.
A repeat prescription is when your doctor prescribes you the same medication on an ongoing basis and is often long-term or chronic condition. A doctor will prescribe a certain number of repeats for a medication, and the patient is then only required to follow up with the doctor. Regarding the condition, once the repeats have been fully utilized or have all been dispensed by a pharmacist, prescriptions are required for a range of medications because they are considered to be potentially harmful if not used correctly, under the supervision of a licensed healthcare practitioner.